Suspected organ damage due to toxic effects requires a systematic histopathological evaluation, as there are no absolutely specific signs of intoxication. However, the combination of macroscopic findings, color changes, and compatible visceral lesions can point toward a toxic etiology when correlated with the clinical history. Drug and alcohol use is associated with multiple systemic pathologies, including cardiovascular, hepatic, renal, respiratory, and infectious diseases, as well as mental disorders. In fact, these substances can cause hepatic steatosis and cirrhosis, renal failure, pulmonary congestion, cerebral edema, or myocardial alterations, creating recognizable lesion patterns in daily practice. At autopsy, certain signs can reinforce the diagnostic suspicion: cherry red coloration in carbon monoxide poisoning, jaundice in hepatotoxic agents, intense pallor in cases of vasoconstriction due to cocaine, or visceral congestion in circulatory failures associated with toxins. Likewise, lesions in the stomach and intestines, as well as findings characteristic of body packer syndrome, provide relevant information. Ultimately, the diagnosis of poisoning is based on integrating the histopathological findings with the clinical context and complementary studies, allowing for a degree of certainty that can be causal, compatible, or negative depending on the strength of the identified relationship.